Hello everyone and welcome back to my channel. Myself Dr. Surabhi Sahney. Hope you are doing great. Now today I come forward with the second benign tumor of oral cavity. This tumor is more important for the viva and more important for the NEET MDS preparation. So if you are preparing for the NEET MDS, then definitely this video is for you, and that too of completely oral pathology. So today's second tumor is the KERATOACANTHOMA. Yes, let's talk about its other name. The first name is the self-healing carcinoma. Second name is the molluscum sebaceum. Third name is the varicoma. And the fourth one is the molluscum pseudocarcinomatosum. Talk about the KERATOACANTHOMA. It is clinically and pathologically similar to the squamous cell carcinoma, although it is having the low grade of malignancy as compared to that of the squamous cell carcinoma. Followed by, it is originated from the pilosebaceous gland. Question is, what is pilosebaceous gland? Pilosebaceous gland is defined as the sebaceous gland which are present at the adjacent or at the edges or at the adjacent to the hair follicle, or which are present at the sides of the hair follicle, which outflow their outlet in the follicular canal that's from the pilosebaceous gland, and this tumor is originated from that only. If we talk about the clinical feature, then clinically it is found in all the ages. It increases with the age also. The second thing is, it mainly involves the face, neck and the dorsum surface of the upper extremities. Along with that, 8.1% we found this tumor on the lips as well as the vermilion border of the upper and lower lip. Clinically, if I talk about the lesion and its presentation, then it is typically present as a solitary lesion. It forms the firm, rounded, skin-colored or the reddish papule that again relatively progress and grows and form a dome-shaped structure with the shiny smooth surface having the ulceration in the center because it forms the keratin plug in the center, right? That will project out as a thorn, right? Now if we see the clinical course of this lesion, first of all, it is appear as a small nodule, goes within from 4 to 8 weeks and then get developed to its full size. Remain as a static lesion for the next 4 to 8 weeks, and after that in the third phase, it spontaneously regress and then come down and become again the small nodule form, right? If we talk about the histological features or the histopathology of the KERATOACANTHOMA, the main feature is that there is the hyperplastic squamous cell present in the epidermis, followed by there is the presence of the chronic inflammation in the connective tissue because they contain the chronic inflammatory cells in it. If we talk about the treatment, then the treatment is only and only the surgical excision. So that's all about the another important benign tumor of oral cavity, that is KERATOACANTHOMA. If we talk about the differential diagnosis, that it could be the squamous cell carcinoma or the verrucous carcinoma, right? Rest of the names are not so important, so that's why I'm not telling you right now in this video. That's all about the today's oral pathology lecture. If you want the notes, you can DM me on my Instagram ID which is shown on your screen. And don't forget, if you have any kind of the query, you can drop me the mail which is shown on your screen. Till then, stay tuned, stay safe. Thank you for watching.